10 signs your feet tell you about diabetes. Did you know that your feet can reveal some of the earliest warning signs of diabetes? Many people don't realize that high blood sugar affects circulation and nerve function, often showing up in your feet before anywhere else. Ignoring these signs could lead to dangerous complications, including infections, ulcers, and even amputations. But don't worry, by recognizing these warning signals early, you can take steps to protect your health. Stay with us until the end, because number one is a symptom that most people ignore, but it could indicate a serious underlying issue. Your feet can reveal a lot about your health, especially when it comes to diabetes. High blood sugar can affect circulation and nerve function, making your feet one of the first areas where symptoms appear. Many people overlook these warning signs, but catching them early can prevent serious complications like infections, ulcers, and even amputations. Poor circulation can slow healing, while nerve damage can make it harder to feel pain, increasing the risk of unnoticed injuries. By paying attention to your feet, you can take action before small problems turn into major health issues. Here are 10 important signs your feet might be telling you about diabetes and what to do if you notice them. Number 10. Numbness or tingling sensation. Have you ever felt a pins and needles sensation in your feet that doesn't seem to go away? Persistent tingling, numbness, or a burning sensation in the feet could be an early sign of diabetic neuropathy, a condition caused by prolonged high blood sugar levels damaging the nerves. Diabetic neuropathy occurs because excess glucose in the bloodstream gradually wears down the small blood vessels that supply nerves with oxygen and nutrients. As a result, the nerves become less effective at sending signals, leading to sensations like tingling, numbness, or even sharp pain. Over time, this damage can progress to complete loss of feeling in the feet, which is dangerous because it makes it harder to notice injuries, blisters, or cuts. One of the biggest concerns with numbness in the feet is the increased risk of unnoticed wounds. If you accidentally step on something sharp, develop a blister from tight shoes, or even suffer a minor cut, you might not feel it right away. Without proper care, these small injuries can become infected, leading to serious complications like foot ulcers. In severe cases, untreated infections can result in the need for amputation. If you frequently experience tingling or numbness in your feet, it's important to take action. Start by monitoring your blood sugar levels and keeping them within a healthy range. Proper blood sugar control can slow or even prevent further nerve damage. Regular foot checks are also essential. Examine your feet daily for any cuts, blisters, or changes in color. Wearing comfortable, well-fitted shoes and keeping your feet moisturized can help prevent complications. If the numbness persists or worsens, consult a doctor as soon as possible. They may recommend nerve function tests, medications to manage pain, or lifestyle changes to improve circulation. Catching diabetic neuropathy early can help you maintain healthy feet and avoid serious complications in the future. Number 9. Cold feet even in warm weather. Do your feet feel cold all the time, even when the rest of your body is warm? This could be a sign of poor circulation caused by diabetes. When blood sugar levels remain high over time, they can damage the blood vessels, making it harder for blood to flow properly to the extremities, especially the feet. As a result, your feet may feel constantly cold, even in warm weather or when you're bundled up. Poor circulation means that less oxygen and nutrients reach the feet, which can cause discomfort, tingling, or even a pale or bluish skin tone. In some cases, people with diabetes may not even feel how cold their feet are due to nerve damage. This is a concern because reduced blood flow also means slower healing, making even small injuries or infections more dangerous. If you notice your feet are frequently cold, try moving around more to encourage circulation. Regular exercise, such as walking or stretching, can help improve blood flow. Keeping your blood sugar levels under control is also crucial, as stable levels reduce the risk of further blood vessel damage. Wearing warm socks and keeping your feet elevated when sitting can also help with circulation. However, if your feet remain cold, change color, or become painful, it's best to consult a doctor. They can check for circulation problems and suggest ways to improve blood flow, reducing your risk of serious complications. Number 8. Wounds and sores that heal slowly. Have you noticed that cuts, blisters, or sores on your feet take longer than usual to heal? This could be a warning sign of diabetes-related circulation issues. High blood sugar levels can damage blood vessels, reducing the flow of oxygen and nutrients needed for healing. As a result, even minor injuries can linger for weeks, increasing the risk of infections or diabetic ulcers. Slow, healing is particularly dangerous because many people with diabetes also experience nerve damage, making it harder to feel pain or notice wounds early. A small cut or blister might go unnoticed, and without proper care, it can worsen into a serious infection. In severe cases, untreated wounds can lead to complications requiring medical intervention, including amputation. To prevent slow-healing wounds from becoming a bigger problem, it's essential to check your feet daily for cuts, redness, or any signs of infection. Keeping your feet clean and moisturized can help prevent cracks and sores. If you do get a wound, wash it with mild soap and water, apply an antibiotic ointment, and cover it with a clean bandage. Managing blood sugar levels is key to promoting better circulation and faster healing. If you notice a sore that isn't improving or is getting worse, see a doctor immediately. Early treatment can make a significant difference in preventing complications and keeping your feet healthy. Number 7. Swelling in the feet and ankles. Have you noticed persistent swelling in your feet or ankles? This could be more than just a minor inconvenience. It might be a warning sign of diabetes-related complications. Swelling, also known as edema, occurs when excess fluid builds up in the tissues, and for people with diabetes, it's often linked to poor circulation, kidney issues, or even heart problems. High blood sugar can damage blood vessels and nerves, leading to circulation problems that cause fluid retention in the lower extremities. Over time, this can result in persistent swelling, making your shoes feel tighter or causing discomfort when walking. If the swelling is accompanied by redness, warmth, or pain, it may indicate an infection, which requires immediate medical attention. In some cases, swelling in the feet and ankles can be an early sign of kidney disease, a common complication of diabetes. The kidneys play a crucial role in filtering excess fluids from the body, but when they're not functioning properly, fluid can accumulate in the legs and feet. To reduce swelling, try elevating your feet when sitting, avoiding prolonged standing, and staying physically active to promote circulation. Wearing compression socks can also help prevent fluid buildup. Most importantly, managing your blood sugar levels is key to preventing long-term damage. If you experience frequent or severe swelling, don't ignore it. Speak with your doctor to determine the underlying cause and prevent potential complications. Number 6. Changes in skin color or temperature. Have you noticed unusual changes in the color or temperature of your feet? This could be a warning sign that diabetes is affecting your circulation and nerve function. People with diabetes often experience poor blood flow to their extremities, leading to noticeable skin changes. Redness or dark patches on the feet can indicate inflammation or areas where blood isn't circulating properly. If the skin appears bluish or purplish, it could mean that the tissues aren't getting enough oxygen, which increases the risk of ulcers and infections. On the other hand, pale or excessively dry skin may signal that blood flow to the area is restricted. Temperature changes are another key indicator. If your feet frequently feel too warm or too cold compared to the rest of your body, this may suggest circulation issues. Warm feet can be a sign of inflammation or infection, while persistently cold feet can indicate poor blood supply. Since diabetes affects the nerves, you may not always feel these temperature shifts, which is why it's important to check your feet regularly. Moisturizing your skin can help prevent excessive dryness and cracking, while gentle foot massages and regular movement can promote better circulation. If you notice persistent color changes, extreme coldness, or warmth without an obvious reason, it's best to consult a doctor. Ignoring these signs can lead to more serious complications, including foot ulcers and infections. Keeping your blood sugar under control and maintaining good foot care can help prevent these issues before they become severe. Number 5. Frequent foot cramps or pain. If you experience frequent cramps or persistent pain in your feet, it could be a sign of diabetes-related nerve damage or circulation issues. High blood sugar levels can damage the nerves over time, leading to a condition called diabetic neuropathy. This nerve damage often results in muscle cramping, sharp pains, or a burning sensation in the feet. Many people with diabetes report cramps that strike unexpectedly, often at night or after periods of physical activity. These cramps can feel like intense muscle contractions, making it difficult to move or relax your feet. Poor circulation can also contribute to foot pain, as reduced blood flow deprives the muscles of the oxygen and nutrients they need to function properly. Pain in the feet, especially if it worsens over time, may be a warning sign of peripheral artery disease, PAD, a condition where narrowed blood vessels reduce circulation to the extremities. If left untreated, PAD can increase the risk of ulcers, infections, and even amputations in severe cases. To manage foot cramps and pain, it's essential to maintain stable blood sugar levels, stay hydrated, and engage in gentle stretching exercises. Massaging your feet and improving circulation with regular movement can also help relieve discomfort. However, if the pain becomes persistent or worsens, consult a doctor to rule out serious complications. Number 4. Ingrown toenails and fungal infections. If you frequently experience ingrown toenails or stubborn fungal infections, your feet might be trying to tell you something about your blood sugar levels. Diabetes weakens the immune system, making it harder for the body to fight off infections, including those that affect the feet. Ingrown toenails occur when the edges of the nail grow into the surrounding skin, causing redness, swelling, and pain. For people with diabetes, even a minor ingrown toenail can become a serious issue. Poor circulation slows down healing, increasing the risk of infection. If left untreated, an ingrown toenail can develop into a painful abscess that may require medical intervention. Fungal infections like athlete's foot or toenail fungus are also more common in people with diabetes. High blood sugar levels create an ideal environment for fungi to thrive, especially in warm, moist areas like the feet. Symptoms may include itching, cracked skin, yellow or thickened toenails, and persistent foot odor. To prevent complications, it's essential to keep your feet clean and dry, trim nails properly, and avoid walking barefoot in public areas. If you notice signs of infection or recurring fungal issues, seek medical attention promptly to prevent them from worsening. Number 3. Dry, cracked skin and calluses. If your feet often feel excessively dry or develop thick calluses, it could be a sign of diabetes-related circulation issues. Diabetes can reduce the body's ability to produce sweat and maintain moisture levels in the skin. This leads to dryness, which can cause painful cracks, especially on the heels. Cracked skin isn't just uncomfortable, it can also serve as an entry point for bacteria, increasing the risk of infections. Since diabetes weakens the immune system and slows healing, even small cracks can turn into more serious complications if left untreated. Calluses, on the other hand, are thickened areas of skin caused by repeated pressure or friction. For people with diabetes, poor circulation and nerve damage can make it difficult to sense uneven pressure on the feet, leading to excessive callus formation. If not managed properly, calluses can break down and develop into foot ulcers, which are difficult to heal and may lead to severe complications. To prevent problems, keep your feet moisturized daily, wear well-fitting shoes, and avoid walking barefoot. Regular foot care and professional checkups can help prevent small issues from becoming serious medical concerns. Number 2. Loss of hair on toes and feet. Have you noticed that the hair on your toes and feet is thinning or disappearing? This could be more than just a cosmetic change. It might be a warning sign of diabetes-related circulation problems. Hair follicles rely on a steady blood supply to stay healthy. When high blood sugar damages blood vessels, circulation to the lower extremities decreases. As a result, hair follicles don't receive enough nutrients and oxygen, causing hair to fall out and stop growing. Loss of hair on the toes and feet is often accompanied by other circulation-related issues, such as cold feet, slow healing wounds, or skin discoloration. If you notice this symptom along with others, it's essential to have your blood sugar and circulation checked by a doctor. Improving circulation through regular exercise, a healthy diet, and proper diabetes management can help slow or even prevent further hair loss. Paying attention to these subtle changes can make a big difference in detecting diabetes-related complications early. Number 1. Foot ulcers or open sores. One of the most severe warning signs of diabetes-related foot problems is the development of ulcers or open sores. These wounds may start as small cuts or blisters, but fail to heal properly due to poor circulation and nerve damage. Over time, they can grow larger and become infected, leading to serious complications. Diabetic neuropathy, or nerve damage caused by high blood sugar, reduces sensation in the feet. This means that minor injuries, such as stepping on a sharp object or developing a blister from tight shoes, may go unnoticed. Without proper care, these wounds can worsen, increasing the risk of infection. Poor circulation further complicates the healing process. With limited blood flow to the feet, essential nutrients and oxygen struggle to reach the damaged area, delaying recovery. If left untreated, severe infections can develop, sometimes leading to tissue death and, in extreme cases, amputation. If you notice an open sore on your foot that isn't healing, seek medical attention immediately. Keeping blood sugar levels under control, Wearing proper footwear and regularly checking your feet for injuries can help prevent ulcers and serious complications. Your feet can reveal crucial warning signs of diabetes, often before other symptoms appear. Ignoring these signals can lead to severe complications, including infections, ulcers, and even amputations. By paying close attention to changes like numbness, slow-healing wounds, swelling, or skin discoloration, you can catch potential issues early and take action to protect your health. If you've noticed any of these signs, it's important to check your blood sugar levels and consult a doctor as soon as possible. Early intervention can prevent serious complications and help you maintain healthy feet. Which of these signs surprised you the most? Let us know in the comments. If this video helped you, don't forget to like, subscribe, and turn on notifications so you never miss an important health tip. Stay informed, stay healthy, and take care of your feet.